Moving on to a next script, that is implant 2. Here you could have started with a case scenario of a peri-implant mucositis, then thereby explain the peri-implant mucositis like that. And then here you could have also mentioned that peri-implant mucositis is also known as an ailing implant. And then while explaining the reasons behind the peri-implant mucositis, you could also mention little in detail. You can refer the image that is attached here, where it is saying that the peri-implant soft tissue, how it is weaker as compared to the periodontal soft tissue and everything. You could take some lines from here and add it over there. Then here it is better to avoid the headings. You could have converted it into sentences. Then while moving on to the peri-implantitis, you can also bring the case scenario aspect here. Instead of causes, you can mention it is risk factor. Then here again more factors are there, like genetic factors and residual cementum. If you can add one line on that. Then coming to the management aspect, here we have added one more line. And then you can also mention what is the acceptable amount of marginal bone loss in the first year. And then you can summarize the treatment aspect with this image that we have put, like if the probing depth is less than 3 mm, if there is little bleeding on probing, what would be the treatment? It's just oral hygiene instruction and local debridement. But when the probing depth increases and when there is bone loss, the treatment aspect will change based on that. Then lastly, you can summarize the script by stating the difference between peri-implant mucositis and peri-implantitis. And you could also mention briefly on the ailing, failing and failed implant, which is a very important question for the exam. Yeah, that's all about the script.